Hello, everyone. We're going to give it one more minute before we start. Well, thank you, everyone. I'd like to welcome you to our webinar today. AFTO thanks you for joining us. Our webinar today is titled Tools for Foodborne Illness Investigations. We are really excited to have 3 presentations for you today, which we think you're going to be able to glean a lot of information from and feel that your program can utilize. We are going to hold all questions until the end. We do have a chat box, so as you have questions for the presenters, feel free to go ahead and enter those into the chat box. And if you could possibly put the presenter's name so that we know which question we'll ask to who at the end. But again, thank you for joining us, and we're going to go ahead and start because we have a lot of information for you today. So I'd like to introduce our first speaker, Dr. Martin Weidman. Dr. Weidman received his veterinarian degree and a doctorate degree in veterinary medicine from the Ludwig Maximilian University in Munich, and a PhD in food science from Cornell, where he currently is the Gellert Family Professor of Food Safety at Cornell University. He's the co-director of the New York Integrated Food Safety Center of Excellence. His research interests focus on farm-to-table microbial food quality and food safety, and the application of molecular tools, quantitative and modeling approaches to the study of transmission of foodborne pathogens and spoilage organisms. I've had the opportunity to work with him, and I think he has a lot of great information for us today. So Dr. Weidman, for you, here you go.
Great, thank you, Brenda, and hello, everyone. So I'm going to start us out by talking about how to interview food workers and managers in an outbreak investigation and as part of an environmental assessment. These slides in this presentation was put together with help from David Nicholas at the New York State Department of Health and Alexa Cohen, a PhD student in my program. And it's brought to you by the Integrated Food Safety Centers of Excellence. These are 5 centers around the US that are really dedicated to providing better training and other support for improved outbreak investigations for foodborne illnesses. So what I'm going to cover today is I'm going to give a brief review on environmental assessments, then talk about how to prepare for those interviews, and then spend the bulk of today talking about how to conduct the interviews. According to NIRS, an environmental assessment is a systems-based component of an outbreak investigation that fully describes how the environment contributed to the introduction and transmission of the agents that cause or could cause illness. So environmental assessment are a key part of an environmental investigation. These 2 terms are often used interchangeably, but environmental investigations could also include other things, or typically also include other things such as sample collection, whether that's stool samples from workers, environmental samples, etc. And we have COE trainings available for these other activities that might be conducted as part of an environmental investigation. The key objectives are to identify contributing factors and environmental antecedents and generate recommendations for informed interventions, and often also help the specific facility that you're conducting the interviews, if a problem might have occurred, to fix these issues there. I'm not going to go into what contributing factors and environmental antecedents are, and there's a longer version of this available as a webinar that you can look at, and many of you, I'm sure, are very familiar with this. How do we prepare for the interview? The first thing is to get in the right mindset. And I think one challenge that I've often heard in this is that many other people who do environmental assessments also do inspections. And this is a very different type of activity when you do an environmental assessment. You know, these might identify a lot of factors that are not covered by regulations. Environmental antecedents are not things that you would typically cite as non-compliance, for example. And here's an example of where you could have conditions, practices that may actually comply with regulations, but may still be a contributing factor or an environmental antecedent for an outbreak. The other thing that often happens, if people are not quite clear, not in that sort of, environmental assessment mindset, and rather come in on an inspection assessment, they might focus on things that are not really relevant. You might have a pathogen where humans are not an important source, but we spend too much time trying to identify sick workers, because we really should be laser sharp focused on the cause of this outbreak and the environmental antecedents for this outbreak. Once you're in the right mindset, there are a couple other things you have to do before you, or should do before you leave for the interview. You want to review any reports, any paper forms, anything else that is there to give you as much background as possible. Review the illness complaint, look at the available EPI information. Ideally meet with, or in these times, remotely meet with or talk to EPI, environmental health, and lab personnel. Lab people can often tell you, with this organism, this is what we know about it, this is how it's transmitted, these are the things you want to look for. Sometimes they might have whole genome sequence data, they might have additional information that will help you identify what to look at. We had a day where they might say, with this outbreak, this organisms, look at chicken as an ingredient, even though the EPI data suggests it was a salad, but there's something that this organism is common in chickens, or look for mishandling of chicken, for example. So there's a lot of information that you can gather by doing this information collection up front. Find records to gather from the facility, understand the questions you're going to ask, and make sure you allocate enough time for the interview. You want to make sure you understand the facility you're working with, the facility you go into. Is it a chain or an independent restaurant? That affects where to get supplies. Where's the food purchased? Is it local or not? Maybe you can find that out. The more you can know about the size of the facility and the layout up front, the better off you are in the actual interview. You want to understand the implicated pathogen. What's the incubation period? If it's transmitted through people, people can be a source. Do you need to ask for illness symptoms like within a day or two, or within 30 days before the start of the outbreak? What are the symptoms of the infection? Is it typically caused by cross-contamination issue, or is it a problem of undercooking or cooling? What other data do you have on the pathogens? Is it Salmonella enteritidis, which would point you towards poultry, eggs as a high likelihood source? Is it Salmonella Dublin, which makes it likely that it's something to do with beef as a source of this outbreak? So get that understanding. Here's a list of key pathogens you might deal with, and possible causes. If you have Clostridium perfringens, cross-contamination ill workers are not the issue. It's really about temperature control by and large, or it could be about bringing in product that already has the issue. So look at that. Bacillus cereus, similar to perfringens. On the other hand, norovirus and Hep A, you don't need to worry about cooling, because that's not an issue. These are viruses that are not going to replicate. Focus on undercooked or raw seafood. Focus on sick workers. Salmonella, that can be a lot of different things. That could be workers, could be undercooking, could be ingredients from a sketchy supplier. EHEC similar to Salmonella, can be also similar to those two. So understand that, because that will help you direct your interview and direct you what you're looking for. Now let's talk about conducting the interview. It typically involves, the environmental assessment typically involves interviewing both managers and employees. Typically you start with managers. That should be one thing you do on the initial visit. And you should make sure you follow your department's state UN policies for interviewing food workers. This may sound counterintuitive, but this interview is about more than interviewing people. We talked to some experienced people that do these interviews, that 50% of it is actually not the real interview. It's watching people, seeing people, listening to people, what they're doing and what they're saying when they think you're interviewing someone else. So be aware of your surroundings, be aware of what's happening, and control that. I literally was in a facility once where I interviewed people to deal with a food safety issue, and I overheard someone go into the front desk and asking the front desk managers to go out and bring Imodium, because we needed Imodium in the facility. I kid you not. Imodium is an antidiarrheal drug, okay? That wasn't on my list to do, but obviously it raised a number of issues. So Situational awareness, huge when you do these interviews. So once you arrive at a facility, introduce yourself to manager and food workers, explain the reason for your visit. Try to keep it as conversational. Make sure people are not intimidated. It makes it much easier to get information, and make sure people tell you things they might not easily tell. The more it's a conversation, let people go off on tangents because they will come up with interesting things in most cases. This might sound a little bit contradictory to the previous one, element of surprise. Before I said introduce yourself early on, but if it's a facility, if it's a fast food restaurant, to just walk around it, see what happens when people go outside and smoke. Maybe go in, just get a general lay of the land first, and then come in and introduce yourself. So that's a on-site visit. You want to be on-site. Sometimes these interviews could happen in an office. You want to actually be on-site as much as possible. If you can interview the employees in the facility, in the kitchen, you're better off because you can see how they interact. You can see more other things. And as I said, observe the facility as much as you can. Manager interviews, part 3 of Lanier's form can be used for this. There's some very clear guidelines what to ask about. I'm not going to go through those in huge detail. So first of all, you talk about the establishment overall, independent or chain establishment. That can help you get information about how supplies are secured, how raw materials are secured, because sometimes you might have an outbreak where it might be 2 or 3 establishments. How are they linked together? Food preparation, is it all on site? Is some of it prepared at the commissary or another location? We've had some, Clostridium perfringens, Bacillus cereus issues, which typically we relate to, issues with cooling at the facility, but the problem actually occurred at a commissary. Ask questions about the kitchen managers. Language, disconnect in language is something we often see as a problem. What is their food safety training? Are they food safety certified? Then ask questions about the food workers. How many are there? What language do they speak? Again, what type of food safety training do they have? Cleaning policies. What are the schedules? How often are things cleaned? Are there written procedures? Or is it we go by recollection? Is there any sort of indication that we actually verified that cleaning and sanitation happened? And then your question about food temperature policies. But again, for some types of pathogens, food temperature is not a big issue. You might still do a few cursory questions, but if you're talking about norovirus, don't spend a lot of time on this because that's not going to be the issue. Employee health policies, obviously very important when you deal with organisms that are transmitted from people. Norovirus, hepatitis, even salmonella, that's where you're going to focus a lot. Talking Clostridium perfringens, Bacillus cereus, not so much. Could be that the employees get the disease because they consume the food, but they're not going to be the source of these diseases. You want to know what policies they have to restrict or exclude ill workers. Do they have an actual sick policy? Is there paid sick leave, or do people not get paid when they stay home sick? That is important because it looks at sort of the types of incentives that people might have to really not come to work when they're sick. Very important. Nearest Part 3 instructions, specify, provide a little bit more details. Who you should interview, the managers have most authority. Semi-structured, where you have some question, but you follow up, you can go off, and you should keep track of the length of the interview. Worker interviews are next. As I said, first try to interview the manager, then go to workers. Pick the workers based on the review of the information with EPI, environmental health, and lab. This can tell you on what days you need to look at. If this is an outbreak that happened over 2 or 3 days, and you can put the exposure when the issue happened to a window of 2 or 3 days. You want to make sure you identify who was there during those 2 or 3 days. If it's an organism where temperature control is important, make sure you interview the people who are responsible for that part of it. Interviewing the servers might be less important in these cases. Try to interview the workers separately from the manager, if at all possible, because you're going to get more information out of them. They're not going to be worried about contradicting their boss or letting something out that might cause them problems. If the manager says they want to be present, or find know what your laws are, know what you can require. I'm not an expert in that, but I'm sure each of you will have someone in your department that can help you with that. Make sure that you're on legal strong ground. Particularly with the workers, even more important than with the managers. Be friendly, talk to them. Don't make it look like an interrogation. Remind them that their answers will remain confidential. With some of these foodborne disease outbreaks or cases, it's very likely that you had a worker come to work despite the fact that they were sick, probably not really following sick policies. You need to identify that. If people fear that there are going to be negative consequences for them, it's going to be very hard to get that information. You want to cross-reference what the workers say to what the managers say about policies, or the workers trained correctly, do they know policies, or these policies on papers that are not really enforced. With the workers, you ask more direct questions about the investigation, about specific types of food vehicles. You might review the specific food preparation practices if there's strong evidence that a certain food caused the issues, etc. Glove usage, use of utensils. Are they taking food temperatures? How are they taking food temperatures? All important questions. And again, temperatures for a certain foodborne pathogen, a lot of question about temperatures and how proper temperatures are assured. With many pathogens, and we talked about hepatitis, noro, salmonella, it is essentially determined whether workers have been sick, particularly in the time frame before their exposure. In this case, you may want to need to interview as many workers as possible. It might just be 1 or 2 sick workers out of a large number. It might be those, it doesn't necessarily have to be those that prepare the food. It could even be a waiter. So you might best get at it if you talk about illnesses among family members. People could be carriers, their family could be sick, but they did not have symptoms, or they didn't have strong symptoms. Sometimes it might simply be easier for them to say their family members were sick than saying, I felt sort of sick, but still came in. Vomiting and diarrhea symptoms are obviously the big one you look for. And again, be aware of the fact that workers might fear retaliation if they say they came to work sick. If you find workers that had symptoms, you want to try to collect their contact info so infectious disease office can do a comprehensive interview. Post-interview, on-site observations. Once you've gone through all of this, you might have a better idea of what to look at. They might tell you this is how we measure temperatures, this is how we monitor temperature. Try to see whether that's really what's happening. This is what we do with glove usage. This is what we do with cleaning and sanitation. Watch, see whether what's happening. If you can sort of loiter around for a little bit after the interview, the more you can see, the better off you are, the more likely you are to find relevant information. You could ask the worker to prepare the suspected item in front of you. If you do these things, if you start taking notes right away, it reminds them that they have to be by the book. So try to be relaxed and not necessarily take notes. And we talked about that, observing not just the behavior, but the overall facility, not just observing the worker that you might have asked to prepare food for you, but always look at what other people around them do too. You might take temperatures, test sanitizing solutions, etc. See what happened when you walked into the kitchen. Maybe you walked through the kitchen at the interview and came back and certain pieces of equipment miraculously disappeared. That probably means someone in the kitchen knows there's something concerning about that equipment, or about, for example, a slicer. There's a slicer that's notoriously difficult to clean and sanitize. that might disappear. We've seen those sort of things. After you're done with both the interviews and the observations, do an exit interview. Discuss the findings with the manager. Make sure they understand why you were here. Make sure they understand what you found. Give them materials and resources that they can use to make sure this issue and the issues you identified don't happen again. Make sure you give them your contact information if they want to get back to you. So overall summary, interviews as managers, employees are critical parts of an environmental assessment. Even if you do other things such as collecting samples, this will help you to identify when, where, and how to collect sample. Prep and understanding of the complaint before you go there is important. You don't just rush out, really try to, and I try to impress this, talk to EPI, talk to lab people. Use that three-legged stool, that proverbial three-legged stool, to get all the information you need. Adapt to the setting. And then important, and if you want to remember one thing, is if you go out to interviews, think about it. The interview is only 50% of it. The other 50% is you watching the behavior, you seeing what's happening in that facility and connecting the dots with that. So with that, I hopefully have given you some useful information. I'm looking forward to answering some questions. There are things you don't want to ask me here or I can't get to, we can't get to, feel free to email me or contact me at any time. Thank you very much.
Thank you, Martin. I think you did a fantastic job because we've got a whole list of people saying, can we please get a copy of his slides? And I will let everyone know that we are going to provide you a recording of this and some additional information that will come out tomorrow from all of the presenters that wanted to make sure you had as much information as you could. So thank you, Martin. Remember, if you have a question, go ahead and put it in the chat box. And if you can put Martin's name beside it, that way we know to refer to him when we ask that question. Let's move on to our next speakers. We have two this time. First, we have Commander William Willie Lanier. Some of you might know him by different names. He is with the U.S. Public Health Service Veterinarian Officer assigned to the USDA Food Safety and Inspection Service. He focuses on learning from foodborne outbreaks to prevent illnesses and strengthening collaborative relationships with public health partners. Commander Lanier also has experience in the CDC, the Utah Department of Health, and the FDA. His professional interests include epidemiology, pathology, and public health policy. He lives with his wife and children near Salt Lake City. Also speaking is with Dr. Lanier is Dr. Maria Scott, and she is a microbiologist with the USDA FSIS and works closely as a member of the Office of Public Health Science. And as part of that staff, she works closely with the applied epidemiology staff that investigates foodborne illness and outbreaks. We thank you both for being here today. I'm going to turn it over to you to present for us. Thanks.
Thank you very much. Greetings, everybody. It's a pleasure to be with you today. My name's Willie Lanier, and Willie works just fine. I'm a U.S. Public Health Service veterinary officer assigned to FSIS, and happy to present today with Dr. Maria Scott, a microbiologist in our science staff, and we're going to be sharing with you some good news that we have revised the FSIS policy on how we assess and use results of outbreak-related food sample analyses from non-FSIS laboratories. In other words, the laboratories of our state and local agency partners. We in FSIS want to collaborate with you to utilize state lab results as evidence during outbreak investigations. However, for many years, we have heard concerns about our process for assessing partner lab results in outbreak investigations. And today, I'm pleased to announce that we have heard you loud and clear and have made positive changes to our process. Specifically, we have decreased the amount of documentation needed for the assessment in many instances, which should decrease the burden on partner lab staff and speed our collaborative response in outbreaks. We'll get to that in more detail later. First, though I realize that many of you are familiar with this, to provide a bit of context, I'm going to give a brief overview of FSIS outbreak investigation. Investigating an outbreak can be like solving a puzzle. We use 4 different types of evidence when investigating outbreaks: epidemiology, traceback and trace forward, laboratory, and environmental health. These all supply important pieces of the puzzle. And to put together these puzzle pieces, we collaborate with various partners, including local and state health and agriculture departments, other federal agencies, academia, and increasingly industry partners. Today, we'll be focusing on how we collaborate with local and state partners on laboratory evidence. Here's a general timeline of an FSIS outbreak investigation based on historical data, realizing that several factors that can influence this timeline, and events do not always happen in this order. The major partners involved are shown above the timeline, and timeframes and investigation phases are shown below. The first step is surveillance and monitoring to detect an outbreak. Once it becomes clear that an FSIS regulated product may be the cause of that outbreak, FSIS opens a foodborne illness investigation. If a source of the outbreak is identified, we move to agency action. Finally, we close out the investigation and conduct an after-action review in order to learn from the outbreak investigation. In our presentation today, we will be focusing on the steps of foodborne illness investigation and agency action, how FSIS works with local and state partners to use their lab results as a basis for FSIS action in response to an outbreak. And as we move to the next slide, I'll turn it over to Maria.
Hi, this is Dr. Scott. This is Maria Scott. So before coming to USDA, I was a research scientist. My specialty was in sugar toxin producing E. coli, so I've been involved in food safety for many, many years. So basically what we decided to do once we reviewed our 10,000.1 directive, we noticed that we needed a lot more detail in there in order to inform our partners in foodborne investigations. So as you can see here, we have a link to the new FSIS directive. It's 10,000.1 and it's revision 0.1. It was posted on August 4th, 2020, just to be sure that you're seeing the correct one. We have provided the link here for you. And why did we do that? As Willie just explained to you, we wanted to be sure that the information needed for investigations, that our lab partners provided to us would be clear. Next slide, please, Willie. So basically, we are very much interested in working with our laboratory partners, and in this presentation, we will begin by calling you guys non-FSIS laboratories, but you are our partners. So the directive will describe some of the decision-making process that the agency follows when we are doing an investigation. Next slide, please. If you look at the old directive versus the new directive, and I'm sure a lot of you have seen the old directive, you'll see that it's been reissued in its entirety. So basically, I would like you to focus on the new directive and not so much on the old directive if you have those in your collection of documentation. So the revision, as Willie suggested, reduces the amount of documentation that would be requested from you if you are an accredited laboratory. And I'll get more into detail about that as we move on. So from now on, I would refer to you guys that are working with us as testing laboratory and not non-FSIS laboratories. Next slide, please. So the staff from FSIS work really closely together with the lead investigators from FSIS. So that would be the applied epidemiology staff. And I'm part of the science staff. I'm a microbiologist with that staff. So we work really closely together in order to do the outbreak investigation. And I'm gonna turn it back over to Willie, and he's gonna describe that a little more in detail.
Thank you, Maria. So let's say there's an outbreak going on and federal, state, and local public health partners are investigating. And during the course of that investigation, a local or state agency collects and a testing laboratory analyzes a sample of FSIS regulated product for the presence of an outbreak strain of a pathogen. FSIS gets involved in this process when a partner notifies FSIS of the sample. And how do you notify FSIS? Well, in addition to phoning or emailing individuals in FSIS whom you know, which is great, we ask that you send us an email to our outbreak notification email address shown here. It's foodborne disease reports at usda.gov. Also, we know it may not always be possible, but ideally, it's really helpful if FSIS is notified before the sample is collected so that we have a heads up and we can begin coordinating early. Bottom line, please notify us as soon as you can about samples and analysis results. So after the sample is collected, the testing laboratory analyzes the sample for the presence of the outbreak strain of the pathogen in an effort to answer the question, is this FSIS regulated product the source of the illnesses? And of course, we all eagerly await the results. As soon as FSIS is notified that a partner has collected a sample or that a partner testing laboratory has results, AES connects with connects the point of contact at that testing laboratory with a point of contact in the FSIS science staff. Then science staff will then request from the testing laboratory the documentation needed to assess the results. And now I'll turn it back to Maria.
I was on mute, sorry. So what is some of the information that I would be asking from a testing laboratory? Next slide, Willie. So one of the big pieces, and it may seem like a simple form that you fill out, and I know all of you are really careful about filling out this form and are really aware of how important this form is. The chain of custody and evidence receipt form is one of the real important linchpins of our investigation. So we are always looking to see if the package was stored properly, if it was handled properly, what the temperature of the sample might be once it arrived at the lab, to make sure it was packed on ice. All these things are really important for making sure that the integrity of the sample has been maintained. And one of the critical pieces of information we look for is a tracking number that's been assigned by either state or local agents that actually collected the sample. And we want to make sure we know all the facts about the sample as much as possible. What is it? Is it a ground beef sample? Where did it come from? What day and time did you actually retrieve it? Who did that? And so all those things printed on the form really gives a really good picture about the origin of the sample and the integrity of the sample. And then importantly, we want to know what needs to be done with this sample. Are we testing it for Salmonella or for STEC? Next slide, please. So as I said, the chain of custody and evidence receipt forms are critical. So we always want them to be put in a watertight sealed envelope and inside the package with the sample. So this always is something that we we'll ask for immediately once we establish contact with the testing laboratory. Next slide. And sometimes it's really critical to get pictures of, photographic evidence of all the documents, the condition of the samples, because this is, the old saying, picture's worth 1,000 words, and it really is true in this case. Here we can see that the package of ground beef that was collected was intact. We have the pack date, the use by date, lot codes, and mark of inspection. So that's a lot of information just from a couple of pictures. Next slide, please. So how does FSIS conduct the review process? Next slide. So someone like me, the science staff microbiologist, will reach out to the testing laboratory and we'll have a discussion about the situation, and we will set a mutually agreeable time frame for the testing laboratory to send information back to us. And then we will sit down, and usually it's two of us that will review the information, and we'll write a summary of our findings and also acknowledge the supporting documentation has been provided, and then we'll pass that information up the chain. Next slide, please. So we'll finalize our assessment, meaning, did we find the results of the testing laboratory adequate to fulfill our regulatory needs? Next slide, please. So then, what information does science staff need from the testing laboratory? And that's the whole reason we rewrote the 10,000.1. So next slide, please, Willie. So when you look at the 10,000.1, you'll see categories for information required from the testing laboratory. So there are some things that we will need from all laboratories, and this will be the list that we'll be looking for. If you have accreditation, we'll be asking for those accreditation certificates, and it should show your date of accreditation, the inclusive dates, proficiency testing, and what type of accreditation you have. Also, what type of test are you accredited in order to perform? And the Clinical Laboratory Improvement Amendment is another alternative accreditation that we accept along with MPI laboratory audits. So some of the quality assurance records, if you're not accredited, we will be reviewing those if the lab's not accredited. And it'll be use of proper controls within the laboratory method, and then standard operating procedures that the lab uses, and the appropriate laboratory methods will be looked at a little more closely. So let's dig into this just a little bit more. Next slide. So we don't tell you what methods to use for the testing, but we do want to be sure that the methods used are comparable in sensitivity and specificity to the methods that FSIS uses. And so you can always take a look at our methods, which is published in our guidebooks, our microbiology laboratory guidebooks, and it'll have all the methods we use spelled out and in a public place. So you can get to those documents through this link that I put into the slides. Next slide, please, Willie. So what are the changes that I want you to pay attention to when you review the 10,000.1? And this has to do with the review process. Next slide, please. So there's going to be a section 5 where you can see criteria that we will use to review accredited non-FSIS laboratory results or testing laboratory results. And it must include acceptable third-party accreditation, which covers the testing methods that will be performed on the test sample that we are assessing. And some of the third-party accreditations that are acceptable to us are ISO 17025, CLIA, and also, as I mentioned, the MPI program. But it must be the most recent audit documentation must be available. Next slide. So in section 6, there will be a review of information that we need from non-accredited, non-FSIS laboratories or testing laboratories. And these will be more extensive information. It'll be more like what we used to ask for all laboratories, which was all the laboratory methods that are used, and this is all spelled out in the document now. The quality assurance records will be also requested. Next slide, please. So all labs, whether they're accredited or not, we will be looking for chain of custody and evidence receipts, an overall laboratory report summary, the point of contact for information if we need information after the assessment or during the assessment. And we would like to know if you have sample reserves available if we need to request those for some reason. Next slide, please. So this is a summary, just to recap what we just talked about. And that is the sample is collected by our partners. They analyze the sample and contact FSIS, notifying us that they have results that impact a foodborne investigation. Then we'll get back to the testing lab. We will ask them, are you accredited or not accredited? And from that point, if they are non-accredited, we will request, of course, the chain of custody and the laboratory results, the same for accredited laboratories, but this is where the process gets a little bit different. We will assess lab methods, laboratory details, and quality assurance records for labs that are not accredited. But for labs that are accredited, we will not be asking those same questions, but we will be asking for a laboratory summary of the information, the chain of custody results. And then we will make an assessment of all that information and take action using the data that has been provided by the laboratories. Next slide, please. So this is just a list of some of the things that the laboratory report summary should include. And that's usually it's a 1 to 2 page document that all labs usually put out after they finish their testing. So it will have information about the lab that's critical, the dates when the results were reported, sample information that pertains to the sample that was picked up and tested, the accession or tracking number, this is very important. And, you know, as you can see, other information. And if the sample isolate was sent out for sequencing, we would like to know the NCBI number for acquisition of the WGS information. Next slide. So this is, you can go to the next slide, Willie. So after we look at all this information, we'll make a determination if the results are accepted, which I've never had a case yet where the results weren't accepted, because typically when we reach out to the testing laboratory and if there is ever an issue, we talk to our partners to make sure they understand what's needed and how to, fix any issues that we think might be critical for the testing results. Then FSIS determines that the results, if the results are not acceptable, we may ask if there's a remaining sample that FSIS can test themselves, or we may collect another verification sample if the appropriate product is still available from the same source. Next slide. So these are just links for you. Again, I put in the directive link for the new directive. I also put in procedures for evidence collection, safeguarding, and disposal. And this will help clarify even more questions that you may have. And the 8080.3 actually discusses how AES and science staff and also our investigational arm work together during foodborne illness investigations. Next slide. So this is just, again, I repeated the same information that's in the middle of the document, just to give you some flow of what the process looks like for you to review at your leisure. And with that, I am complete, but I'll hand it back over to Willie so he can tie it up for us.
Hey, thank you very much, Maria. And yeah, I'll leave it on this summary slide here. In summary, in response to feedback from our public health partners, we've updated our process for how we assess lab results of analysis of FSIS regulated products. The most common example of this is when a state lab tests a product during an outbreak investigation and notifies FSIS of the results. And the key update here is that accredited labs and labs in a state meat and poultry program are now required to submit less documentation than in the past for FSIS to assess results. And our goal in making this update is twofold. First, we make this process simpler and decrease the documentation burden on state labs. And two, to make the process faster so we can use state results to support more timely public health action in response to an outbreak, such as recalls of FSIS regulated products, with the goal of shortening the outbreak and preventing illness. And if you look on this diagram, you'll see that the top arrow is intentionally longer than the bottom arrow because it includes that process of, or that step of assessing laboratory methods and quality assurance records for non-accredited or non-MPI testing labs. But in the bottom, does not have that step. So it's meant to visually represent that process can be shorter for accredited or MPI testing labs, which I believe will account for most, if not all, of the labs. Also, a reminder there at the very bottom in that box, how to notify FSIS. And really, we request that you notify us as soon as possible in this process via that email address, foodborne disease reports at usda.gov. So we'll wrap up. We're so grateful that you've been a part of this webinar, and we're grateful to have this opportunity to present. And we look forward to your questions at the end of this, I believe. Thank you very much.
Thank you. That was fantastic, Dr. Lanier and Dr. Scott. We really appreciate this. We believe this is going to make a change, this updated policy. So thank you very much for sharing that information with us. Remember, if you have questions for either of the presentations that we've had thus far, go ahead and put those in the chat box, and we will be reviewing all those questions and getting some answers for you at the end. So our third speaker today, certainly last but not least, is Dr. Kirk Smith. He is the manager of Foodborne, Waterborne, Vectorborne, and Zoonotic Disease section at the Minnesota Department of Health. He has managed foodborne disease outbreak investigations at the Minnesota Department of Health since 1999. He is co-chair of the National Council to Improve Foodborne outbreak responses. He is chair of the Council of State and Territorial Epidemiologists Enteric Disease Subcommittee, and he's director of the Minnesota Integrated Food Safety Center of Excellence. With that, I'd like to turn it over to Dr. Smith. Thank you.
Thank you very much, and good afternoon, everybody. Well, foodborne disease seems not to have stopped for COVID. Surprise, surprise. This year, as usual, we've had several multi-state outbreaks associated with widely distributed food items, and these are the sorts of outbreaks that we'll be talking about today. These numbers are a bit dated, but the trend continues. The number of multi-state foodborne outbreaks that we've identified has increased markedly over time. And Salmonella, Shigatoxin-producing E. coli, or STEC, and Listeria cause a large number of illnesses, hospitalizations, and deaths, as well as $6 billion in illness costs annually in the United States. They are leading causes of multi-state foodborne outbreaks, although Cyclospora is also causing outbreaks routinely now, and other pathogens are sometimes involved as well. But whereas multi-state outbreaks comprise only 3% of all foodborne outbreaks, they account for 1/3 of hospitalizations and about half of foodborne deaths, and so they are exceedingly important. Okay. And just last month, CDC published this MMWR showing that they work on a median of 24 multi-state Salmonella, STEC, and Listeria clusters per week, and more than 40 or even more than 50 per week during the peak season in the summer and the fall. Okay. So our problems are not only the increasing number of multi-state clusters, but also that investigations are increasingly complex with the increasing complexity of food production and distribution. And also that traditional epidemiologic methods often are not sufficient to identify an outbreak vehicle. And by that, I mean hypothesis generating interviews and analytic studies. Okay. So food tracebacks traditionally have been done after a food vehicle has been implicated by other means like epi and methods and lab testing. But tracebacks have become increasingly necessary as part of the epidemiologic investigation to implicate a food item. Sometimes tracebacks are the only way to identify the vehicle of an outbreak conclusively. If it's not the only way, a lot of times they're important in validating conclusions based on traditional epi methods. And even if they're not needed at all, they certainly can accelerate identification of the vehicle versus using traditional methods alone. And so when tracebacks are used in this context, they're called informational tracebacks, or sometimes epi tracebacks or investigational tracebacks. Okay. So the underlying principle is that informational tracebacks serve to increase the specificity of case exposure information. So if two cases in a cluster both eat iceberg lettuce, each at a different restaurant, you know, that's not so interesting because iceberg is a commonly eaten food item. But if traceback can show that the iceberg lettuce came from the same supplier, then that provides more compelling information. Okay. So these are the 4 conditions that, when they're all met, show that informational product tracing might be useful. Okay. So when there's a molecular subtype cluster of cases that likely represents a common source outbreak, and really doesn't even necessarily have to be a molecular subtype cluster. When cases occur in multiple locations and not necessarily multiple states, when interviews reveal no obvious common exposure amongst all cases, suggesting that the outbreak vehicle is a commercially distributed food item, and when a vehicle cannot be clearly implicated with traditional investigation methods alone. Okay. Product tracing or informational product tracing is almost always useful when case subclusters are associated with multiple establishments, when a statistical association with a food item is identified, but uncertainty exists due to concerns about combined consumption with other food items, like in salads, sub-sandwiches, or mixed fruit dishes, for example. When there's possible involvement of stealth vehicles, like little chopped up jalapeno peppers in salsas or guacamole, or other factors about the outbreak that don't really align with the statistically implicated vehicle. Also, when there are statistical associations with more than one food item and the analysis cannot clearly implicate one of them, And finally, when a borderline statistical association exists. Okay. So product tracing is also often useful when the proportion of cases that report eating one or more particular types of food is appreciably higher than expected. And so the plausibility of these associations can be quickly assessed with a binomial probability model and real, or if we don't have real, estimated background exposure frequencies. And so kind of combining this binomial model with traceback to a common point is really used a lot these days in trying to confirm a food vehicle. Okay. So the lead EPI investigators usually initiate informational product tracing by identifying regulatory agency collaborators, establishing clear lines of communication, and importantly, providing a detailed outbreak summary and requesting the product trace. And so for multi-state outbreaks, of course, this involves collaborative data evaluation by multiple health departments, CDC, and state and federal regulatory agencies. So prioritizing exposures to trace is critical and should be based on a number of factors, including the likelihood that the exposure is truly the exposure of interest. So if a case has a single exposure to a suspect food item, that is much better than that case having 3 exposures from 3 different sources. Also, the availability of documented details of the purchase, whether it be from receipts, shopper cards, bank statements, or etc., is much preferred. And so these are the details that the epidemiologist investigators need to provide to the regulatory agency that is conducting the trace. I won't go into the details other than to emphasize that the importance of trying to verify the purchase date, to get shopper card info if available, and to obtain leftover product, packaging, or packages purchased at the same time if they're available. Okay. So conducting the trace, the appropriate agency should interview the manager who orders food at the facility. It's very important to clearly explain the purpose of gathering the info. You should describe the outbreak and why the food item is being investigated. Try to be super clear that the food item has not been implicated yet, and sometimes it's a matter of ruling out the food item rather than ruling it in. Make sure the manager is clear on specific meal or purchase dates of interest, and gather records corresponding to appropriate food shipments to the establishment, and remember to consider all possibilities for that. So even a brief phone conversation can be sufficient to advance the investigation if in-person efforts are not possible right away, and sometimes in-person efforts are not needed, okay? So as the manager provides info on suppliers, shipments of item or items, they should provide written, hopefully electronic documentation. And this typically is invoices or bills of lading. Okay. So food establishments generally adhere to first in, first out when rotating their inventory. And whereas speaking with the manager about this is critical, it's equally important to interview line level staff to confirm that policies really do match reality, and you need to determine if variations to establishment policies exist. It doesn't necessarily matter what they usually do, it matters what they did in the time frame of interest. Okay. So if a local agency is retrieving invoices and bills of lading for another agency to conduct a trace, or whoever's contacting this information, it's super important to ensure that the invoices reflect all food shipments and or in-cash purchases that could have been used on the meal or purchase date of interest. You know, but certainly you want to try to have them assess which shipment they think is most likely. Okay. So the agency conducting the trace should create timelines, flowcharts, or diagrams illustrating distribution pathways of exposures. Now they really should contain dates associated with key elements, such as shipment dates, lot codes, date and time of receipt of product, etc. And so this is an example of one of my favorite data representation formats for establishment subclusters. It's from a multi-state salmonellosis outbreak associated with tomatoes, and there were cases in 5 restaurants in Minnesota. So each row represents a unique case case restaurant exposure. Going across, the colored boxes represent tomato shipments received at each restaurant by grower and the number of days before each case's meal date that the shipment was received at the restaurant. So only when you put a bunch of cases together does it become clear that grower A, in pink, is a commonality between all cases. And this, from the same outbreak, is a nice example of the display of purchase orders and corresponding dates going back from each restaurant to all of the growers that were potentially involved. Okay. So tracing data are best interpreted through joint analysis by EPIs and regulatory agencies conducting the traces. Ongoing, and this should be an ongoing and fluid process that changes as more data are included. Constant communication is necessary. Sometimes exposures need to be reprioritized based on the information that's coming in. And I would stress that I really think that this is one area that could be improved in tracebacks that I've been aware of over the years. Okay, so traceback info is just one of many sources of info. You need to integrate it with other information to construct a coherent narrative of what happened in the outbreak. And just keep in mind, not every exposure will trace back to a single point. Despite our best efforts, the exposure for a particular case may not have been the right one. There certainly are irregularities in record keeping. And so to combat this, this is one of the reasons why we need to try to conduct traces on exposures from as many good cases as practical. Okay. So as distribution pathways cross political boundaries, of course, each pertinent regulatory agency should be notified and engaged, state and federal. Large distributors, though, frequently will have info for a product all the way back to the source, and whoever's in contact with these large distributors initially should try to nab that information when they get the chance. Okay. So when product traces are required to help identify or confirm an outbreak vehicle, they need to be done quickly. Okay. So gathering info by phone, fax, or email is likely to be more efficient than sending inspectors to gather physical records. And this, I also want to stress, in the first phone call, please convey urgency to facility managers and set firm deadlines that are in hours, not days. Okay. Foodborne, especially these big multi-state outbreaks, are emergencies, and we just cannot afford to lose days in an investigation. Now, if you're not getting a response, then you might want to send a field investigator to the facility. And finally, rigid criteria should not slow the process down. Timeliness is more important than complete standardization, although I will re-emphasize that we still do want records to back up conclusions for informational tracebacks. Okay. Challenges include lack of detailed and accurate records at distributors, lack of internal traceability. We're obviously working on that as a nation. So for every point in the trace, attempt to verify information using documentation from one step upstream and one step downstream. This redundancy can prevent incomplete records at one node from breaking the trace, and they also may point to kind of missing records from one of the facilities, okay? Because not all records are always provided, and so keep digging if something doesn't seem right. Coordination of multiple local, state, and federal agencies can also be a challenge. Obviously, there are competing priorities, different resource constraints, different legal authorities, and varying levels of experience. Some jurisdictions may have only one or two cases and thus may not give the investigation a very high priority. However, I will emphasize, I've seen it many, many times, single cases in a given state can be exceedingly important in triangulation and really sealing the deal. Okay. So obviously these things can be very resource intensive, but they're such a critical tool and are really needed so frequently nowadays that ideally capacity would be developed to conduct this type of traceback somewhat routinely and not just as an extra burden on top of normally scheduled work. Alternatives do exist for jurisdictions that cannot spare resources. They might be state agencies to back up local public health agencies. It might be the FDA-sponsored rapid response teams, or it might be district or national FDA or USDA FSIS, who in the past have at times even said that they might be able to visit points of service. Okay. And I really think it is worthwhile to build a functional network and system for conducting this type of work. Okay, and that starts with the API agencies. They should develop a contact list for all potential regulatory agencies and a protocol for engaging them. Identify key stakeholders and engage them in developing protocols and training. And so do that relationship building ahead of time. And then everybody should create agency-specific response protocols that include key staff, contact info, procedures for data collection, and information sharing. Okay. So in my last few minutes, I just want to show you that there are quite a number of tools and resources that you can go to kind of learn more about informational product tracing. Okay. And the first I want to call out is the FDA-sponsored rapid response teams. And you can see that there are teams in many states now. And one thing that they have done is created a very nice best practices manual that you can get at the link provided here. There's a very comprehensive chapter on tracebacks. There's a nice section on informational tracebacks and quite a number of tools and examples that can be used. There's a nice table that lays out the factors to determine the appropriateness of doing a traceback for an outbreak investigation. Kind of some narrative process bullet points. Some typical problems and potential solutions to troubleshoot those problems, like when firms are slow in providing records or you're getting kind of incomplete records. More of the same. This is too small to see, but I just want to show you that there are examples of flow diagrams for tracebacks. Another example. And then finally, they have a traceback information gathering worksheet that you can use in the field when conducting a traceback. Okay. Okay. And then Martin, at the very start of this webinar, kind of mentioned that there are 5 integrated food safety centers of excellence, and Martin is affiliated with one, and I'm affiliated with the one in Minnesota. But in Minnesota, we do have quite a bit of information on informational tracebacks on our website, including a nice narrative. You can get a white paper on the topic there. You can get our version of a traceback information gathering worksheet. And this is a white paper that was finalized back in 2015. That was a collaborative effort between the Minnesota Department of Health, the Minnesota Department of Agriculture, FDA, CDC, and the University of Minnesota. And if you don't want to read the whole white paper, we've kind of distilled the kind of made a Cliff Notes version of the informational traceback process. It's there are 2 parts. Each part is just the front and back of one page, and part 2 is the one that is more applicable, maybe to AFTO members. Okay. And as I mentioned, we do have a traceback information gathering worksheet that'll help you in the field. Kind of a checklist to help you to remember what things you need to ask. Okay. And there is quite a bit on this topic out in the literature if you really want to be hardcore and read about this stuff in detail. Okay. And finally, I want to talk about the Council to Improve Foodborne Outbreak Response, or C4. And AFDO is a member of C4. And C4 recently released the 3rd edition of the Guidelines for Foodborne Disease Outbreak Response. And for the first time, informational tracebacks are really treated in detail in the C4 guidelines. They're mentioned in Chapter 3, especially in Chapter 5, Cluster and Outbreak Investigation. There's a rather detailed narrative on the processes there. And then also in Chapter 7, Special Considerations for Multi-Jurisdictional Outbreaks. Okay. And finally, along with the C4 guidelines, we have the C4 Toolkit, which helps working teams kind of work through the guidelines, kind of figure out whether they are kind of meeting those guidelines or whether or not they want to prioritize some of the things for installation or improvement. And right now on the website, what they have up there is the toolkit for the 2nd edition of the C4 guidelines. the third edition of the toolkit, showing here it's not finished, but will be available somewhat soon. We don't know exactly when, but it kind of gives the keys to success and whether or not you already have them in place, and lets you prioritize them for implementation or improvement. So yeah, and then how you make plans to implement selected C4 recommendations. Okay, so in summary, informational tracebacks are a critical tool in today's outbreak investigation world. The capacity and processes to conduct them regularly and quickly should be developed if we can, okay? Close collaboration with happy partners is necessary, and relationships should be developed upfront. Plenty of resources on this topic exist, and opportunities to practice abound, real opportunities. And whole genome sequencing, I think, should provide greater confidence that using resources on informational tracebacks is truly warranted, because clusters are even more likely to be true common source clusters. And so with that, I just want to acknowledge Aaron Simonich from the Minnesota Department of Agriculture for helping to develop this presentation. Thank you.
Wow, that was fantastic. Thank you very much, Dr. Smith. We have a few questions in the chat box, and I'm going to encourage everybody to go ahead and put your questions in the chat box so that we can get some answers. I'm also going to bring up all of our speakers and ask them to turn their video on. And as they come on, we are going to just actually introduce them so you can put a name to a face, and then we'll start going through our questions. So Dr. Smith, you just went. I'll let you go ahead.
Yep,
there we go. And Dr. Weidman, you're on mute. There you go.
Hello,
Willie.
everyone.
Hey, everybody. It's Willie.
And perfect. And Maria.
Hello.
Hey, well, thank you all for your great presentations. I'll tell you, it doesn't matter how many times you hear information about foodborne illness and investigations, there's always something that you learn, a new idea, a new thought, a new trick, and then we're grateful to the information that the USDA has provided us. So I believe that there's lots of information that could be gleaned from this today. So go ahead again, put your questions in the chat box, and I'm going to start. The first question, Martin, what is the estimated time that the environmental assessments typically take, maybe assuming that you interview at least one manager and one worker who are identified to be highly involved in that process?
I mean, obviously a lot depends on the size of the facility too, because you do want to see it, but I'd say count on at least 2 to 3 hours, probably more than a 3 hour time frame. If someone else wants to jump in, I don't know, Kirk, whether you have any thoughts on that?
That's probably about right.
Okay. All right. Willie, we have a question for you. Is the process to become an accredited lab difficult, or is it just the process is long?
Maybe Maria would be better for that question.
Okay.
Well, the process is quite complex and involved, and it is kind of long, and all the details would probably be best directed at an agency that does accreditation. But yeah, it's not a simple process.
Okay. Thank you. Let's see. I have another one coming up. So I think this, it came in without a name, and it came in about the time, Kirk, that you were talking. Would you talk about shellfish tracebacks and how they are potentially different?
Oh man, I'm sure there's lots of people that are better to talk about than I am. They're absolutely a whole different beast, and we could have a separate webinar just on that. I don't think we have the time to get into it.
Okay.
But I mean, you know, there's like shell tags and everything like that at the points of service and the distributor that are used specifically for that purpose, I guess, is the main way that they're different. If anybody else wants to add, feel free.
Anybody want to add to that conversation? Okay. Are there times, let's see, I'm not sure who this is for, but I think it would apply to everyone. Are there times you've had to work internationally? Is there an international network for outbreaks?
Well, I think there's a loose international network for outbreaks. It's, obviously when a vehicle of a foodborne outbreak comes from a foreign country, it's FDA, and imagine occasionally USDA that's involved with kind of working with those governments on that. Our FDA works a lot with Mexico on produce outbreaks when the vehicle's imported from Mexico. We don't on that state level have as much interaction with foreign countries.
That's true. Anybody else want to add to that?
One game changer a little bit there, and I agree with Kirk, it's largely informal. There are, some, depends on how you define international, and some more formal agreements, obviously, between the US and Canada that are very well coordinated in outbreak detection and outbreak response. But whole genome sequencing and the associated whole genome sequencing databases, such as the pathogen detection database, have international data in it. So that can even be very valuable in a small outbreak that's linked to, let's say, a restaurant or a retail establishment. Because if you have a whole genome sequence and you search it against the database, and let's say all the matches are isolates from a certain country, then it probably points towards an imported food, for example, or some other link. So that's really becoming the game changer. I would still characterize it as informal, but we are in a situation where CDC, Canadian equivalent, many public health agencies all over the world are adding their isolates with whole genome sequence data and some metadata, so some description, human isolate, year, sometimes even a month to those databases. So I think, and we're going to see that continue to develop and really be a paradigm shifting thing in this space.
Okay. Continue.
I can add to that.
Go ahead.
Just a little bit from the federal perspective, we cultivate relationships with our partners in other countries, like the equivalents to the USDA or FDA from the food regulatory side, or to CDC on the EPI side. So whenever there's a cross-border international outbreak, you'll see a lot of that, just like states work with each other and states work with their federal counterparts. The federal agencies will work with their cross-border international counterparts. And then kind of as Martin was mentioning, like other countries will have their version of PulseNet. So, often there'll be an international query about, hey, have you guys seen this pattern back in the PFG days or in the sequence days, similar. So there is a lot of cross-border collaboration for sure.
Okay. Anybody else want to comment on that one? We have another question, and it's regarding produce, since it goes through so many hands and sometimes it could be blended, about the amount of time that should be spent when there's almost no electronic records or paper records available and the product could be sourced in a different country. I'm actually going to say on this one, and then we'll turn it over, is that now that we have the new produce safety rule, FDA is spending a lot of time as part of those investigations to help work with the states who are enforcing and regulating under the produce safety rule to bring that together. So I do know that is something that's in the works as far as learning new skills and tools. I'll turn it over to you guys and let you also answer that one.
Well, yeah, I mean, this lack of traceability, especially with produce, I think has been the major impediment to foodborne outbreak investigation since I started doing this in the late 1990s. And so it's always been recognized as a problem. We made progress towards it. I think since Dr. Yanis has come on board with FDA, that, I'm hoping that we'll make even better progress towards it, because it's major impediment.
Anybody else want to comment on that?
Yeah, it's even more complex, right? Because I mean, in produce, we don't have a kill step, stating the obvious here. So contamination occurs in the field. And often it's water sources, it might be wildlife. So even if you have really good traceability, you can trace it back to one field. But an outbreak could be linked to multiple fields in a larger region, which all are contaminated with the same or similar subtypes. And so then you take an outbreak of 50 cases, for argument's sake. That usually, with good traceability, it's easy to trace back. But now there's 50 cases, might be 10 letters from field A, 100 remain from field B, 100 blah 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 from field C. Now it gets even more complicated. So think, produce traceback, there's a lot of things that make these just so much more complicated than other sources. Maybe not the shellfish comparison comes up, right, Kirk? I think we see the same thing, not a kill step. Contamination can occur in wider ranges, multiple harvest areas, potentially making it really complicated.
Okay. We've got time for one more question. If anybody wants to put a question in, I will, while we wait for just one more second, I will say that I could appreciate what everyone had to say. And I know that many agencies, many states have multiple agencies that are involved in foodborne illness outbreaks and investigations. And one of the things that I was always heard being part of the Florida Department of Agriculture's food safety program is that you never want to meet the people that you need to work with when an actual event occurs. So make sure that you're exercising, you're talking, you're learning, you're finding out who these people are and putting your protocols and plans in place. So that was a very good point that you made, Dr. Smith. I'm not seeing any more questions. I'd like to ask our presenters if any of you have anything you'd like to add before we close out today. Okay. Again, I will remind everyone that this has been recorded. We do have a lot of information we'll be sharing with you tomorrow in an email along with a link to this recording. We really appreciate you all participating in this. We've had an amazing turnout. This topic is always very interesting and people are always very needing to get more information. And we thank you all. We wish you a very safe and happy holiday season. And we'll join you again next time. Have a great day.
Thank you.
Thank you all.
Holidays.
Thank you.
Thank you.
Happy holidays.